As you can see here, with the topical steroids thin the skin. Well, they do, and when they're doing that, they destroy the skin's function. And if you keep putting them on, it gets worse and worse. And when you try to stop using them, you get a kickback, you get withdrawal symptoms. And to me, that comes from the brain frantically trying to save the skin, but the topical steroids are continuing to damage it. But because it reduces the inflammation temporarily, the doctors, use that, and we don't have anything else. And this goes back over 70 years ago when the first topical steroids came out, and that was hydrocortisone. But now we have topical steroids that are 500-600% stronger than hydrocortisone. And my question is, why do we need such stronger, inverted commas, drugs to treat a condition that was treated by something that was only 1% versus 100% so-called strength? These drugs do a lot of damage. Hydrocortisone is the original one, and if it's used continuously, it's gradually eroding the skin itself, not necessarily just the surface, but underneath the skin, which is the most crucial part of the skin. This gives you some idea, basically, of, to me, it's desperation, competitional rather than therapeutic, because that's only a tiny fraction of the number of types of steroids. They use all sorts of different chemicals and things, and they create different chemicals, and they put them and they test it, et cetera, et cetera. And it's great because it reduces the inflammation, usually on the first application, and then it keeps going like that. But what it's doing over that period of time is gradually eroding the skin, and completely, not just on the surface, but under the surface. And the tissue, the skin tissue, is extremely complex. And when you think what it has to do, it has to protect us. It has to have extraordinary complexity, from heat, from cold, from pain, pressure, all sorts of different things. But these drugs actually, I've used these for years as a general practitioner. It's the first thing you reach for because it was so good, because it reduces the inflammation. The patient feels better. They're not scratching so much. So if the child is not keeping its parent awake all night. These are simple, basic reasons for trying to overcome the condition. But what you're actually doing is gradually, or nowadays when you're looking at some of these drugs which are 600% stronger, rapidly destroying what's going on under the skin. But you don't realize that when you're treating patients with hydrocortisone, for instance, because it's a gradual change, et cetera, et cetera. But the addiction starts. When you try to take it off, the skin starts flaring, starts bubbles, blisters, all sorts of things start happening. Might be all right for 3 or 4 months, and then suddenly it'll blow up in front of you again. So you go back to the topical steroid, the same one, you try that, you find, well, it probably doesn't work so well, but there's a new one out now that's just a bit stronger than that. And so on it goes. But now we have drugs that are said 600% stronger than what hydrocortisone was. Now, the question is, why would we have to increase to that extent to cure what is really a minor problem? So what we're actually doing is aggravating the situation. We're suppressing, these drugs suppress the immune system. Yeah. And a large part of our immune system exists in the skin. It's there to protect us. That's what our skin's for. It's not to look good in the mirror. In my mind, I used to hate using this stuff because I knew that ultimately the patient would return and say, well, it's just getting worse. I need something stronger. Well, because everybody else is doing it and because it's recommended in the journals and things like that, you do it, you use it. But then you find you have the same cycle. You get withdrawal symptoms and they get worse. And, the next thing, the child or the patient is in hospital with topical steroid withdrawal syndrome. I've seen patients, and I've many patients online that have been in hospital and they've been suicidal with this because of the weeping skin, the pain, the itch, the depression. The drugs affect the central nervous system. They affect your emotions, everything. And people suicide because of this condition. And I think probably most doctors have experienced that, or most certainly GPs and dermatologists. When you get something that can help this condition without using topical steroids, well, it's changed my life and changed the way I treat people. And I have a young child, and I can show you in a minute what happens with probably we'll leave it till the slide comes up. So here I've said the topical steroids don't heal the skin. They don't heal the skin. They damage the skin. They thin the skin. This gives you, this picture is just there to show you, give you some idea of the complexity of the skin. It's not just a layer over the muscle and the tissue of the body, and which holds us all in together in a big bag. It's a highly complex system, and it has to be because it has numerous functions that it has to maintain, protective functions. This just gives you some idea of some of the, well, I can't say that the functions or give you a good talk on that, but in the sense that it is a complex organ, and this is a very, very simple version of the skin. It is far, far more complex than this.
Wow.
And when you think about its protective, responsibility, it makes sense that the skin is very, very complex. The skin is the biggest organ on our body, and it contains us. That's a big job, and it's doing it all the time by transmitting via these receptors and things to the brain constantly, 24 hours a day, and the brain is returning with its instructions on how to maintain that particular part of the body. It's a huge job, and I think we underestimate what the brain does. And this is just, the skin is just one part of it, but it's doing the whole body. It's doing your heart, your lungs, and your blood circulation and everything else. So it's pretty busy. And 24 hours a day. It doesn't get a smoko, as we call it in Australia, time off for a fag. It's just there, and without it, we don't survive too long. This poor young lady is a classic example of how severe these drugs can be, how damaging. And I mean, can you imagine the psychological impact on this young woman? She's already lost half her hair over here. That's caused by the topical steroids, because what the topical steroids are doing is destroying, damaging, severely damaging what's going on underneath the skin, not just on the skin itself. It's eroding the skin, but it's also affecting or disaffecting the normal physiology underneath that skin. And I don't know what happened to her, but you can understand why quite a number of these people commit suicide, because they can't bear to live with the pain anymore and the appearance. And people end up in hospital, many patients in hospital suffering from this condition. This is coming back to the functions of the skin, and this gives you what is pretty much the same as the other one, but it's just another view. But you can see here, well, there, for instance, sweat glands. Without sweat, if that's not functioning properly, our skin, we're not able to release heat from our body. So we overheat. This deep arteriovenous plexus, which is a big word for blood vessels, these get eroded. So that the nutrition to the area, the oxygen to the area, all the necessary nutritional things, aspects reaching the skin, compromised. We've got here, well, I've said the blood supply. the fat tissue, which is very important in terms of our control, our body temperature control, etc. And all these little other objects down here are sensory organs, and they're there for touch and for heat, for cold, etc. Our ability to feel anything is in the skin. But if that's not connected to the brain, we don't feel anything. So the same thing applies with the blood supply to the area. That starts to reduce. It loses its ability to supply the skin, and the skin starts to atrophy or get thinner. When you put steroids on that, you're aggravating that situation. You're thinning the skin, and you're starting to destroy the functionality of the skin, because the steroids, bit by bit, sometimes rapidly, eliminate or destroy that part of the skin. In time, the skin starts to thin down. It loses its function, and then it breaks up, and then it gets infected, and then all sorts of complications can happen. And we go back to that young lady, that's the sort of thing that can happen. And these patients invariably end up in hospital. And as I say, suicide is not uncommon because of this condition. I look at that and nearly weep, because it's horrible. But I've seen patients like that, and I've managed to get them back onto, I must admit, not quite as bad as that. But in general practice, I've been able to get patients with quite severe condition back together with the grass, but usually only applying it maybe once a week or once every couple of weeks. And that's a rule. It's a basic rule with wheatgrass: don't over-treat. The less you use, the better it works. That works against what most people think. It works against what my view was: 3 times, 4 times, 6 times a day was obviously better. But with the grass, to me, it's about the brain itself has its own ego, and it doesn't need to be kept being told what to do. Like you and me, we don't like to be, I don't know about you, but I don't like to be repeatedly told to do something. I had enough of that as a kid. But it's true. Less is best when you're when you're using the wheatgrass. And I think that anybody who's listening, that's very, very important. And it's a lesson that I think the most important lesson I have learned in my, I think, 27 years of working with this extract.
One thing I'd like to ask, if you could give some examples of the dosing or the usage you've done with certain people. Like, you wouldn't do it 6 times a day. You might do it once just to cover the area and wait a week or wait 2 weeks. Can you give us some real examples? Because that's really important for people to know, because it's more effective when you do it in a smaller amounts and less frequent. Is that right?
It's much more effective. I have absolutely no question about that. If you over-treat, really you're asking for trouble. And I think it's because basically, if we're looking at reconnecting these damaged receptors with the brain, that's really what we should be doing, instead of destroying those receptors.
Okay.
And the wheatgrass, or the extract, the bioactives in wheatgrass,
mm-hmm.
and probably in many other plants, but the wheatgrass, I think, has a better or a stronger response. Essentially, in my feeling anyway, and I've used the extract for 27 years in thousands and thousands of patients, and this includes the many thousands that I get coming through my website, because I give free advice. I talk to people about their conditions. I help them as much as I possibly can. They send me photographs. I follow them up. Some of these cases have taken me 18 months, but we get there. We get them out of hospital. We get them looking after themselves. And most important of all, we get rid of their red skin syndrome. This is a little baby. This just shows you how the stuff, how quickly the wheatgrass works. This child had been having topical steroids for 3 months on a baby that was about 6 months old. that makes me tremble. You know, you're putting a powerful drug on an infant's skin. And to me, I just don't think that's the way to go. This child had been, I think it was just hydrocortisone they were using, but that's the weakest ones. And that's the kind of damage that it causes. It's old skin. It looks like the child's sort of, 75 years old. But that's destruction at its worst, in my view, because of the age of the child. I did this one by online, actually, and I just told her to put the grass on a couple of times a week, just a little bit, and that's what's happened. After 3 weeks, but I've got hundreds and hundreds of these patients on record, and so but I just choose the ones that sort of show us that are most appropriate, I think, in this sort of presentation. But so that's pretty good. And the child, the follow-up, mother was very happy that she didn't have to use the steroids anymore. And there are lots of mothers around the world that are now saying that. And the more I see, the happier I am, because I feel that I've done something worthwhile with my life. This is another one of my patients. She's in England. And you look at this, what she's got here. She's been using topical steroid for some time. She was, like so many people come to me with this, they're desperate. They're absolutely desperate. I mean, she can't go to work like this. She hates the look of herself in the mirror. She's getting side effects from the topical steroids, and nothing's working. And she's desperate. Plus she was losing hair. It's a fair bit for a young woman to have to deal with. And all they're doing is sort of increasing the strength of the topical steroids. And I think what I've already mentioned, I think that doesn't make sense. So we kept in touch for over 6 months, and she's come good because we stopped everything. She had to go through the withdrawal, and I warned her of that. But I said, if you can prepare, if you can have the courage to get through the withdrawal, we'll fix your skin. And she was prepared to do that. And that's how I approach my patients. I don't sort of say, well, this is going to work and fix you and make you happy for the rest of your life. Let's see what happens. But if you can stop the steroids and we just go back to the grass, it will gradually normalize that tissue. And I think the way as I said, normalize that tissue by making those reconnections with the brain. And what this does, it sort of opens your whole mind or changes your mind about how you approach a patient.
If you could just repeat that one more time and explain that, because I think people really need to understand that very important way that you work,
Well, as I say, the topical steroids, a lot of drugs, they're trying to reduce the inflammation.
Okay.
They're trying to fix the skin, but you have to look at why the skin is like that and try and fix that.
Go to the source. Yeah.
I think you are right. I think there's something going on here that is important in terms of the healing process. It's helping the body fix itself rather than trying to fix the body.
Perfect.
With drugs.
That makes sense.
And I think that's what's happened here. She's stayed with it. She's given it time. She's forced herself. She trusted me, and she's come good. But I've got really thousands of patients that have done this, and I'm not bragging. I'm not just talking about topical steroid withdrawal. I'm talking about many other conditions, because that same principle. I'm looking at the principle rather than the condition.
Yep.
How it happened and how we can change that. Now, this is the sort of thing that can happen. This is called elephant skin. This is just one of the complications of topical steroid damage. And this patient, who had actually lived nearby me in Queensland, and she had this elephant skin around the elbows here. But she also had all over herself. Her skin was bad everywhere. This is a particular complication where the connective tissue of the skin is destroyed. And that's why she got this elephant skin. That's why it's all crimpled up. It's not just the skin surface that's affected. It's the whole skin itself. All its supports, all its soft tissue supports, etc., are damaged. And this is why this happens. And strangely enough, 5 years later, I bumped into her. We actually came across it. We met each other, and she said, "You fixed my topical dermatitis." I said, "Yeah, I remember." I said, "How's that elbow look?" And she said, "I'll show you." And she brought us through, and I thought that was out in the street, and I thought that was pretty good, you know. But she's very happy because she was covered. Her whole body was just, you know.
Wow.
A mess because she was totally addicted on these steroids, topical steroids. This one down the bottom, again, we see here elephant skin around his wrist, right? That's again because of the supportive tissue under the skin has been destroyed. So what I'm trying to say here is not just the skin. The skin is an extremely complex organ, and it has to be. It's got to carry us around in a bag. And well, that's what it does. And it's got to function. If it doesn't function properly, we're in big trouble. If it gets infected or whatever. But it just gives you some idea of what we've managed to do here on the, well, I've got that's what it was on the right. When he started the treatment, on the left, where he's got the elephant skin. He's still having problem in the other one there because he's in the withdrawal from the topical steroids. You can see the redness. You can see the flaking on the skin. These are the signs of this condition. But the ridges in his wrist are really quite significantly reduced. That's in a couple of months. That's pretty good because usually there's no treatment for this at all. This woman at the top here would have been stuck with that for the rest of her life. You'll like this one. This is an American lady who contacted me some years ago. And she was desperate, as you can see. It's not surprising. She was about 21. She's an attractive woman, and she's antisocial. Understandable, isn't it? Given the severity of her condition. But again, we have topical steroid damage and her withdrawal symptoms because she decided to stop the drugs herself. And this is what happened. She was very sad and very serious, and I felt for her because she was such a young woman, and she's now, I hear from her still, must be 10 years ago. And now she's got a family and children and things, you know, and I feel good about that. But then in those days, she was close to suicidal. The other thing about that photograph is that it's usually the top part of the body where the redness is worst. And it's probably because it's around the blood supply, and the blood supply in this area is much greater. And so when you're destroying the skin and its circulation, you're getting that. I think that's why that redness, that's just one of my theories. But, the important thing is that we got her life back. And that's what's happened to so many of these people. It's to me, it's terrible. I just really feel for them because it shouldn't be like that. But, you can't really blame the doctors because they don't have anything else to work with. And this is where, I hope one day that what I'm doing can help a lot of other people and help the doctors do what they're doing. But it's more a cultural thing, an academic thing, a big pharma thing. There are all sorts of influences that keep doctors away from natural remedies. I was absolutely, as I mentioned before, anti anything herbal or, natural remedies, etc. But I beg forgiveness, and I think I've been, sort of returned to I have not returned to the medical port, but I sort of do have a lot of people out there that I feel very pleased that I've been able to help. This young lady, she was a nurse. a Japanese nurse. She came to see me in Melbourne. I had a Japanese clinic in Melbourne for some years because my wife's Japanese and I speak a bit. And she had her nails like this for years. I think it was 10 years. She destroyed her nails with topical steroids, and you can see the dips in the nails. It was really quite severe, and it affected her severely. I mean, she'd always sit like that with her hands under her armpits. She lacked self-confidence, and she didn't have a boyfriend, and she was lonely, etc. And we fixed her, and by June she had a boyfriend, and I felt very proud about that.
That's great.
But at the time, I didn't think it would help her because I didn't really understand or have much understanding. Not that I have 100% now, but I have a much better understanding of how it works now than then. And in those days, I was plastering it on 3 times a day, but I don't do that now. I've learned that less is best. And I think if people, that's the one lesson, it's the one thing that I would like people to leave here with is just less is best. Don't overtreat. You're telling the brain how to do its job. You don't like to be told how you do your job, and I don't like being told how to do mine. So that's a pretty rough analogy, but it's better than nothing. I mean, nails are skin. It's part of the skin. It all evolved from there, and so it's going back by the same century.
Okay.
To the brain.
That's good to know.
But it's not that either. It's the tissue around the nails and the blood vessels and everything else like that. So that's hope for people with damaged nails. This was a miracle. Well, it wasn't. Well, it was a physiological miracle. This patient had severe eczema for a long period of time, and her daughter contacted me and asked me if I could help. She started using the wheatgrass. It was helping her skin, the scaling and everything, and the redness, etc. But then it reached a certain point of the healing when she suddenly woke up in a wet bed from her legs, from her arms, from her whole body. And she came back and she said, "Why has this happened?" Yes, well, I'll have to think about this. I had no idea. But now that I'm sort of understanding a little bit more about how it works, to me, if what's actually happened, the skin has lost a lot of its contact with the brain. And one of those important things is blood circulation to the skin.
Right.
And it seems that what's happened here, after a certain period of time, that's right, she put it on her legs and her arms. That's right. She'd been using the topics. That she woke up the next morning and the bed was soaking. And I thought, well, how can that possibly happen? But, now I start to realize that, yes, what my theory is starting to make sense, that it's suddenly making this reconnection. And there's been this sudden, you have a global effect. She hasn't put the stuff all over her. So it seems that it goes back to the brain, and the brain comes back to all those areas. So this brings on a totally new idea about the grass. It's only through these clinical observations that I've been able to get any idea of how it might work. And this is one of them. It's been a fascinating journey and learning, but I learn far more from my patients than I ever do from textbooks. That was an amazing thing, but I've had many amazing responses. I just love working with this stuff, but it's just remember that less is best. Don't overtreat, and it goes with the oral stuff as well. I take half a teaspoon of that shots, and I think I mentioned before, once a day. But I'm over 80, and I don't need so much, or I probably need less. I think most young people, if they want to take it once or twice a week, is fine. But but we're looking at a whole body effect here, because going straight to the brain, and that's what's controlling everything. That's the way I see it. But you don't need much.
I think in the case with the water and the sweating, considering the skin is so complicated, so many processes had to come back online, and it included all these different communications with the brain, the sweat glands and all those different complicated parts had to sort of come back online and reconnect to the brain. So I would imagine, as you say, what I think it'd be important for people to understand is this is a holistic, interconnected solution to so many things. And then it can focus on the healing or the wound area very effectively. Do I have that right?
Yes, well, that's the way I see it. However, it's not the way I'm seen as having it. But that's all right. I don't really worry what people tell me about, or the scorn that well, I don't get so much anymore. I think I'm getting too old, which is a good method of defense. But no, the thing that worries me is are my patients. And if I can help them, I help them. Having a physiological concept of how it works, I think helps me advise people much better. But that's the thing that I've walked the floor on for 20 years before suddenly the penny dropped. But the fact is that I was dealing with something that I've never come across before. And I was the last person in the world that would even think about recommending a herbal remedy. And I feel very, very fortunate because I've come across this, and it's because it's helped so many people, and I can die happy. So there you are.
Yeah, I think the people need to understand that, first of all, in my opinion, there's nothing wrong with your brain at all. Number two is the motivation behind what you do is to help people. And I think that's what's made this so profound. And I think people need to understand that type of spirit, as I mentioned it before. And number three is these really work, and they are consistent with the way the body works. Drugs are not, we are not a lack of drugs when we have an illness. We are a lack of our whole bodies being abundant and doing the work that it needs to do. And our goal, our job is to remove the resistance from allowing the natural flow of the body to work. And I think that's why this is so amazing. And I'm so grateful that you're here to share that with us again. And, I think it's awesome that people hear this information. But even more important, you have thousands of real cases and pictures to show why this works and how it works. So I think it's really impressive to have people to understand this and listen to it. And then I would definitely take advantage of communicating with Dr. Wheatgrass himself from that email address, which is here, info@wheatgrasshealing.info.
.info. Yeah.
There you go.
But I can say something. Can I say something to you?
Yes, please.
I'd like your followers to know that you helped me tremendously. You helped me with your concepts of acupuncture, etc. You knew exactly what I was talking about. It clicked, didn't it? In terms of where you were coming from yourself, and you helped me, or you helped consolidate that in my mind about what you were doing, because suddenly acupuncture made sense to me. You know what I mean?
Yeah.
Well, and the other approaches that you have, and I think we're on the same wavelength. I think there's, I'm just coming from a different direction or using a different method, and so I'm very grateful for that. And you should get a little flower or something like that. I'll send you one. But it's been really great working with you, and you've been very helpful. So thank you.
Oh, thank you. It's an opportunity because when I see this information that you're giving, my method of working is to collaborate and understand that other people have great information. And then it's my job to share that with as many people as possible because it's so important. And it is consistent with the nature of the way our body works. And that's why it's so exciting to do it, because that's the greatest resource when the body takes over and it unleashes and we get rid of the resistance for the body to do miracles. And we've seen it in our presentation today. I mean, that's what's exciting for me. And I take no credit. You're the man. You're doing all the work.
Can you tell my wife that? That's right. I'm only joking. Yeah.
But I think we've covered quite an amazing topic, and we are blessed because he's agreed to speak with us again. We can go into even more detail, but I think through this situation, these cases, we show the universality of the healing method, and we've used it in one treatment, but it can be used in so many things. I was totally blown away with your leprosy cases and your leprosy slides. If everybody hasn't done it yet, there's a video of how we used it with stroke victims during his philanthropy trips, where it was very exciting to see the transformation: stroke, leprosy, skin dermatitis, steroid use, all these things. So everybody should have an open mind to see the potential of how this can work in so many ways, but especially understanding the communication link between the skin and the brain is very important. So thank you again.
And I really appreciate your open mind and your support, because it gets a bit lonely out here sometimes, you know. But I haven't cried myself to sleep yet. No, I know that this, you know, when something changes your life like this, and you're training in medicine and everything else like that, one incident just changed me completely, because I knew we never see that sort of thing in clinical medicine, that sort of healing, and that removal of that elderly patient's that scab or the crust over that wound. That doesn't happen in medicine. So that was just serendipitous, I think. Pure luck, but I'm glad it did.
Good intuition, I'd say, as well as good luck. So, well, thank you again for this opportunity. I really appreciate it. And I've got people in mind already that need to review this with all of these great cases and stuff like that. And I look forward to seeing you again. And I would always cherish the opportunity to speak with you offline, and any time that you want. I'm here for you, kid. You're doing a great job, and the world needs to know about this. Thank you very much for your.
Thank you very much. Thanks, Joe.
All right, take care, my friend.
We'll catch you soon. Yeah, thanks.